Good morning. I'm Joyce Gallagher, Deputy Commissioner of the Department of Family and Support Services Senior Services and Executive Director of the Area Agency on Aging. With me is Julia Talbot, Senior Policy Analyst for the Department. And online also are Kelly Richards and Jessica Belzy from IDOA, who will respond to their appropriate questions. So as you can see, we have an agenda in front of us. We'll do an RFP review, and then after we'll have the questions and answers, and you can type in your questions on your dashboard. So let's get started. So within the Department of Family and Support Services, there are a number of divisions: Children's Services, Homeless, Youth, Veterans, Domestic Violence, Workforce, and Human Services, and of course, Senior Services, which is the topic of our webinar today. So DFSS launched the strategic framework in 2016 with a refreshed mission and department-wide priorities. If you'll bear with me, I'll go through our mission. Working with community partners, we connect Chicago residents and families to resources that build stability, support their well-being, and empower them to thrive. Our priorities are to deliver and support high-quality, innovative, and comprehensive services that empower clients to thrive. Collaborate with community partners, sister agencies, and public officials on programs and policies that improve Chicagoans' lives and advance systemic change. Inform the public of resources available to them through DFSS and its community partners, and steward DFSS resources responsibly and effectively. The Senior Services Division is designated as the Area Agency on Aging for the City of Chicago. In that role, we advocate, plan, coordinate, and fund services for older adults, especially those in greatest social and economic need, living alone, and those ages 60 and above. Together with our service providers, we provide vital services such as congregate dining programs, home-delivered meals, caregiver support, respite, ombudsman, and access to benefits. So for this RFP, which is why we're here today, the Regional Long-Term Care Ombudsman Program investigates and resolves complaints on behalf of residents of long-term care facilities concerning matters that may adversely affect their health, safety, welfare, or rights. The Long-Term Care Ombudsman Program shall monitor the development and implementation of federal, state, and local laws relating to long-term care. Changes to keep in mind. This is the first time that the City of Chicago has sought to secure a delegate agency to serve as the city's regional long-term care ombudsman. DFSS seeks to ensure that the ombudsman program is fully staffed, including the recruitment and use of volunteers, to provide appropriate access to ombudsman services across Chicago. The landscape is that in Chicago, we are responsible for monitoring the quality of care provided to adults with disabilities and adults ages 60 and older, residing in 160 different care facilities containing 20,435 beds as of today. The program is ultimately required and responsible for monitoring any and all eligible facilities and beds regardless of the number, which may change due to new facilities and facility closures. In response to the state long-term care ombudsman programmatic guidelines in the past 12 months, the Chicago region, which is Area 12, we have attended 98 resident council meetings and 6 family council meetings where they advocated for the rights of nursing home clientele. We completed a total of 1,687 unduplicated visits or 2,251 consults to individuals and 1,089 consults to facility staff were made. We participated in 23 community education events and 29 facility staff in-services. We investigated and closed 960 cases and 1,556 complaints. The RFP Scope. So our long-term ombudsman program provides the following to the residents of long-term care facilities: investigative services, regular presence in long-term care facilities. We issue advocacy, information and assistance, phone consultations to individuals, resident and family council support, volunteer management, community education, education to long-term care facility staff, formally consultations and in-service trainings to long-term care facility staff. The long-term care Ombudsman Program primarily provides services to older Americans, adults with disabilities, their families, and communities. Our priorities: investigating complaints and concerns. The long-term care Ombudsman will work to resolve complaints to the satisfaction of residents. We identify, investigate, resolve, or attempt to resolve complaints made by or on behalf of current long-term residents. Pursue administrative, legal, and other remedies on behalf of the residents. Document and report cases, complaints, resolution efforts, and activities as required by the state long-term care Ombudsman. We advocate to improve the quality of care and quality of life for residents of long-term care facilities in Illinois. We promote and protect the rights of long-term care facility residents. We represent the interests of care facility residents to government agencies, legislators, and policymakers. We develop an advocacy issue-based initiative on a topic relevant to care facility residents for annual implementation. We empower seniors and adults with disabilities to self-advocate. We support the development and maintenance of resident and family councils and assist in addressing council concerns. We provide community education sessions as well as education sessions to residents and staff of long-term care facilities about the rights and benefits of residents and services available. Our priorities: to provide information to residents about residents' rights, long-term care options, supports and services in nursing facilities and in the community, to inform residents and their family members, citizens organizations, the public, and facility staff about the Ombudsman Program, to share information related to the facility's health and safety issues with the Illinois Department of Public Health when applicable, participating in surveys of long-term care facilities conducted by IDPH. We listen in order to understand an issue from the resident's perspective. We provide residents access to the program through routine visits. We receive reports and complaints from residents, family members, and other concerned parties. We maintain confidentiality. We may not discuss or disclose any information without the individual's permission. Maintain confidentiality of their identity and securing their residents or their legal representative's approval, as well as the state's approval before disclosure of identity. So the location. DFSS will not provide space for this program. The long-term care Ombudsman Program is expected to operate out of a site open to the public with standard hours and day of operation, staffed by paid staff and volunteers. This site may or may not be co-located with other senior service delivery programs provided by the respondent, but the long-term care Ombudsman Program must operate a standalone program with its own designated space. The program is expected to be open for business at least 7 hours each working day, not to be closed for more than 4 consecutive days at a time, and be open for business no fewer than 245 working days per calendar year. Confidentiality. Maintaining confidentiality of residents' identity and obtaining appropriate consent before disclosing the resident's identity is imperative. The program will have stated policies and procedures that ensure the confidentiality and right to privacy of all callers' identities, details, and outcomes of calls, complaints, interviews, and investigations. The Regional Ombudsman Program will provide secure storage for paper and computer files and documents and maintain a firewall that prevents the sharing of confidential files inadvertently. Budgeting. The Long-Term Care Ombudsman Program will also work with DFSS to develop the programmatic budget. This budget will be used for vouchering and be reported to DFSS on a monthly basis. No advances will be given on this contract, thus applicants should be able to have startup costs on hand and voucher promptly. Staff and volunteer training. To ensure that all ombudsmen meet the same standards for professional conduct and engage in similar problem-solving techniques across all regions, every ombudsman is required to complete a standardized training program consisting of 2 levels of training and a minimum of 4 hours of mentoring. Level 1 training certifies the individual as an ombudsman, allowing them to work as an ombudsman. Level 2 training and additional service hours cover the policies and procedures specific to providing services in Chicago. Currently, Level 1 training is provided by an ombudsman certified by the State Ombudsman Program. To conduct the training, Level 2 training is provided by the State Ombudsman Program. Level 2 training dates will be made available by the state office upon request. Paid ombudsmen are required to complete 10 additional hours of training per year. The regional ombudsman is required to complete 18 additional hours of training each year. Volunteer ombudsmen are required to complete 6 additional hours of training per year. Staffing. The mandated staff ratio for the long-term care ombudsman is 1 staff per 2,000 beds. In Chicago, this averages out to 10.2 full-time paid ombudsmen. All ombudsmen will need to be recruited, hired, trained, and provided with continuing education hours on an annual basis. Volunteer ombudsmen do not count towards the minimum staffing ratio. While ombudsmen are frequently required to work with legal service providers, they are not allowed to work as such or provide legal advice in their ombudsman roles. Their duties are considered to include the following: conduct site visits of long-term care facilities, monitor and evaluate living conditions, quality of care, investigate complaints filed on or behalf of residents, interview residents, complainants, and other witnesses, gather information, and prepare detailed reports, advocate on behalf of residents to mediate and resolve complaints, and ensure that facilities are providing quality care to its residents, provide information and referrals, provide information and assistance on obtaining needed social and supportive services, respond to inquiries from the general public regarding long-term care options, guidelines for selecting a nursing home, and federal and state laws on residents' rights, maintain records on assigned cases, load and prepare case and work activity reports, document and input details for state and federal agencies, attend meetings to provide information on the rights of residents of long-term care facilities and the region's programs and services, participate in recruiting and training volunteer ombudsmen, advocate for legislation to promote improvements in the quality of care for residents of long-term care facilities. The performance measures. The following benchmarks are minimum requirements. All performance measures benchmark projections for Chicago are based on 160 facilities with 20,435 beds. Closed cases. Target for fiscal year 2020, 860. 43 closed cases for every 1,000 beds. Information and assistance, formerly consultations to individuals. Target for 2020, 701. 135 information and assistance activities for every 1,000 beds. Regular presence visits. Target for fiscal year 2020, 157. One regular presence visit shall be made at least once per calendar quarter. Regular presence visits are required at skilled and intermediate care facilities, shelter care facilities, assisted living, and shared housing establishments, and supportive living facilities. Facility staff training sessions, formerly facility staff in services. Target for 2020, 8. One training session for every 20 long-term care facilities. Community education sessions. Target for 2020, 22. 12 community education sessions plus one additional session for each benchmark required FTE. Performance measures continued. Resident council meetings. Target for fiscal year 2020, 135. Attend at least one resident council meeting at a minimum of 85% of the nursing facilities within the program area. Full-time staff. Target for 2020, 10.2 full-time. Maintain a ratio of 1 full-time staff for every 2,000 beds. To monitor and recognize immediate progress for the above performance indicators, DFSS intends to track output metrics that may include but are not limited to tracking of Ombudsman Level 1 and 2 training completion and certification, tracking of volunteer hours, development of written standards and procedures concerning intake, opening a case, closing a case, file security and confidentiality, staff and volunteer training and management. Selection criteria, strength of proposed program. The applicant clearly demonstrates the ability to provide the services outlined in the scope directly to the identified target population. The applicant has expertise working with the target population and has relevant capabilities and/or infrastructure needed to serve this group. The applicant's proposed program aligns with best practices for the services to residents of long-term care facilities, including skilled and intermediate care nursing facilities, intermediate care facilities for persons with developmental disabilities, assisted living and shared housing establishments, supportive living facilities, specialized mental health rehabilitation facilities, and medically complex for the developmentally disabled facilities. The applicant demonstrates a clear understanding of the target population and their needs and challenges. The performance outcomes and quality. The applicant demonstrates evidence of strong past performance or can demonstrate other notable accomplishments in providing services to the target population. The applicant has demonstrated strong past performance of recruiting, managing, and using volunteers in program activities. The applicant has the relevant systems, processes, and infrastructure needed to track and report performance on program outcomes. The applicant has experience using data to inform, improve its services or practices. The applicant has the relevant systems and processes needed to collect and store key participant and performance data securely. Organizational capacity. The applicant has qualified staff responsible for program oversight and management. The applicant has adequate systems and processes to support monitoring program expenditures and fiscal controls. The applicant has adequate human resources capacity to hire and manage staff. The applicant provides a realistic timeline for staffing up and can demonstrate how the program will operate until full staffing has been achieved. The applicant's organization reflects and engages the diverse people of the community it serves. Reasonable cost, budget justification, and leverage of funds. The applicant has the fiscal capacity to implement the proposed program. The applicant demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work or work plan. Applications are due on March 3rd, 2020 at 12 noon. Good luck. Here's Julia Talbot.
Hi. Well, thank you, Joyce. So I'm going to go through basically how to make an application in the City of Chicago's e-procurement system. The e-procurement system is found online. You can get to it by going to the City of Chicago website and then clicking on the Department of Procurement in the drop-down box that says Departments, and then there'll be links to go to the e-procurement. Just some places for technical assistance. If you have questions about your registration in the e-procurement system, you would basically go to the Department of Procurement Services and you would email them at eprocurementsupport@cityofchicago.org. However, once you're in the application itself, you can get technical assistance from our the Department of Office of Budget and Management's helpline, and that's 312-744-HELP, or which is also 4357. The helpline is 5 days a week, and it runs from 9 to 5. And generally speaking, they will get back to you within 24 hours of your making a call and leaving a message. There's also a wide variety of training materials and videos on how to work through or walk through the e-procurement system. And in addition, in the attachment section of the application that we've posted for you to fill out, there are several handouts on how to do various things in the e-procurement environment that people often struggle with. So my biggest tip, an application tip, is to start early. If you've never done business with the City of Chicago, register into iSupply or e-procurement as soon as possible. The registration usually takes about 5 to 7 days to be processed by the city, and before that, you really can't start doing an application. So if you do not currently have an account in this system, please go and get one now. You'll save time. The biggest thing that we find with our applicant pool is that people generally just don't always budget quite enough time for themselves, and then they have a less positive experience. So we, you know, just my general overarching thing for people is always just start early. Give yourself more time than you think. In looking at our application itself, you would look, you know, looking at the attachments, you'll see the RFP narrative and scope. And I suggest that you really read that narrative and scope and read it closely. There's a lot of information in there. It really talks about the ins and the outs of the program and what our expectations are. And it will help you in formulating better answers to the application questions. All of our application questions align with the scope and the selection criteria that's outlined in the RFP. And so really, you'll be doing yourself a favor by reading the RFP document prior to starting your application questions. I would carefully review the selection criteria and make sure that your answers align with the selection criteria. All of the application questions that we've developed each refer back to a specific selection criteria outlined in the RFP itself. And that will help guide you in knowing and being able to determine what your organization is going to best be able to do, or what the best answer for your organization's proposed scope of work is going to be. From a sort of a more technical standpoint, there is a 4,000 character limit for each text box. So each application question has a 4,000 character limit. And when I say 4,000 characters, I mean punctuation, spaces, letters, numbers, special characters. So you have 4,000 of those things in which to answer each application question. It's not 4,000 characters for the entire application, it's 4,000 characters per question. The e-procurement website seems to work best in the Internet Explorer browser. It seems that people have the fewest number of sort of glitches or problems with the system in that browser, although it does work all right in others. The other thing would be, do not use your back button when on your browser if you need to manipulate through, when you're manipulating through the application itself. When you use the back button, what will happen is that the system will sort of stop taking your information. So say you're answering a question and you use the back browser button and then you answer another question, that second question probably will not be recorded unless you're saving frequently, in which case I think that the system actually kicks you out. Next slide, please. So when one of the things about working in e-procurement, you can submit your application anytime prior to the due date, and then you can pull it back. So if you're worried about your application not being submitted, this is a good way that you can submit and pull it back as many times as you want or need to prior to the March 3rd deadline. I really encourage people very strongly to submit early. A lot of times, and we'll be going through some screenshots next, but there often the application is incomplete. It's not, you go through about 5 or 6 different steps when you're submitting the application, and so it really takes a couple, it's not just a submit and go and you're done. It's submit and then you go through a couple of screens and the system checks your work, and if it finds things that you haven't filled out correctly, it gives you a message, and then you're going to have to go back and do those things. So I really, before you can submit, I really encourage you to budget 15 to 30 minutes, if not an hour, for the submission process itself, so that you get your application in on deadline. Going to the third bullet point, late applications cannot be accepted. In fact, we are unable to accept a late application. If you find yourself in the position of pressing submit at 12:01, what usually happens is that the application will seemingly disappear on your screen, and basically what that means is that you missed the deadline. And once that has happened, there is no getting it back. I say make use of the e-procurement hotline, 744-HELP, and again, please understand that the hotline operates only during business hours. So save often and submit early. The RFP said that it was due on February 24th and the deadline now March 3rd. That is something I will look into. I believe that the deadline actually is February 24th and that there's an error. well, the deadline is now March 3rd. But that will be part of our amendment. So going on the technical assistance aspect of this, how to accept an amendment and addendum. So now we know we will be doing an amendment / addendum to this process. And part of this, everybody has to accept the amendment / addendum to be able to go do the application and process. So I'm going to show you I'm going to walk you through the screens that you will actually see to do this, to complete this process. So the RFP that you are interested in has been amended. And in order to start an application, you need to acknowledge and accept the amendment. And that, so now, please note, like, this is just basically these are screenshots not specific to your application. So you are going to go to if the RFP hasn't been amended, you're going to go to this actions and say create quote. If it has been amended, which it will be, you will go, it will say this has been amended, and you'll go to the view amendment history page. So to begin the acceptance and acknowledgement process, you're going to open the RFQ in the view only thing. So you'll click on the document number, which is number 1. To review the amended changes to the RFP, you're going to click on the eyeglass icon. Some people think it's a little infinity sign, whatever, but click on it. And to acknowledge, and that will allow you to see the changes, the amendment that has been made to the document. And then to acknowledge receipt and understanding of these changes, you're going to click on the Acknowledge Amendments button. And by acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP in this amendment. So when you get to and so that means that you've basically clicked on that little eyeglass box and you've read what the amendment changes are, and that you are agreeing to be responsible for knowing what those changes are. So when you get to the screen, when you click on the screen number 3, the acknowledging amendment, you have to click this really tiny button that says that you accept the terms and conditions, and then you're going to click the acknowledge button on the upper right hand side. And then that will take you to this screen that basically says all amendments have been acknowledged successfully, and you may now respond to the negotiation, which means you can start your application. You want to proceed, and you want to say yes. Now, if you'd already started your application, by pressing yes, that will bring all the work that you had done originally on the application into the new amended RFP. So when you click on, you'll click on yes, and then it will take you to a checkbox where you accept the terms and conditions, where you have to click on another really tiny box saying that you have read the terms and conditions and that you accept them, and then you will click on the accept button in the upper right-hand corner. And that is the final step. So moving on to you've accepted your amendment, you've done your application, and now we're going to talk about how to submit your application, because as I indicated in the prior thing, that sometimes it is not always the most straightforward experience. So when you are ready to submit, you're going to start by saving your draft one last time, which is in the upper right-hand corner, and then you're going to hit continue. And then that will take you to most frequently, it will give you sort of an error message. And the error messages are found in the upper left-hand side. And it will say any number. It says, in this one, it says you must quote at least one line on the RFQ. You'll see, if you look right down on the left-hand, on the left-hand side, you'll see there's a little tab there that says lines. That means that when you go to that lines, that's where you enter in your budget. So we actually ask you to upload an Excel spreadsheet budget, but the line section is where the system registers that you have entered in, you've entered the budget in. You can do one of two. You really have one or two options. It doesn't, for the purposes of our application, we really only look at your Excel spreadsheet. So in that line section, you can really just add zeros or you can put in your budgeted, but it's important that you put in a 0 in every line. So here's another example. So that's kind of just what I was saying here about the lines. Here's another one that says a quote value is required for the requirement first name. So anything that you talk about, when they talk about quote value in this system, that is eProcurement's way of saying question. So if a quote value is required, every application question has a name to it, like first name or contact information or program description, which you can see in that left-hand column that I've circled under requirements. And the quote value is where you put the answer. So if you get this kind of an error, it will say anything about a quote value. It means that you did not answer a required question, and you need to open up your requirements where the application questions are and fill in the answer and the quote value, and then continue to save. So once your application is free from errors, so you've saved and you've hit continue, this will put you into the review and submit phase of the application itself. And this is your last chance to review all your data and confirm that it is accurate and it confirms that what you have said. So you're going to check your attachments and you're going to scroll to the bottom of the screen to see all of your responses and make sure that this is where you want it to be. And at the bottom of the screen, you'll be asked to provide an electronic signature. And then this is just a little, like a pro tip. Please be sure to fill in the signature before you check the box. If you check the box first, it won't take. You have to fill in the signature and the title and then check the box, and then you hit submit, which is in the lower right-hand corner. And then you should get this submittal confirmation screen. If you don't get this confirmation screen, you have not submitted. And this is the only confirmation you're going to get. The eProcurement system is not capable of sending any confirmation email, so it is very, very critical that you save this screen. If you are like me and like to really be certain about things, you might consider taking a screenshot of it and saving it so that you have proof that you have confirmation and you have proof that you have for yourself should anything happen. This is very unlikely. Nothing has ever happened to somebody. There's never been an instance thus far in this system where somebody has a confirmation email and the application was not received. If you are particularly worried, you can always email me and I will provide you, and I can check the system and I will send you an application. And that kind of concludes what I have to say about the eProcurement system. Again, save often, submit early, give yourself a lot of time. Call me if you have questions. My email is down below. You can call me or Joyce if you have programmatic questions. I will make sure that you can call me because I'm probably easier to get a hold of than Joyce. Okay. And now we're going to open this up for questions, and I thank you very much for your attendance.
Good questions about the startup. If there's a question, can this be a startup organization? So we will answer that question now.
In terms of it being a startup organization, that is a personal decision. You have to enter into a contract in the city of Chicago, you have to be able to do business in the state of Illinois. And by the definition or by the requirements stated in the RFP on page 17, you have to be a nonprofit. So whether or not you're a startup or not, as was indicated in the the webinar, the city is not going to give any advances on money for this program. So as long as you are capable of doing business in the state of Illinois, you've registered into the eProcurement system, you have a 501c3, and you have the requirements to enter into a contract with us, there's no reason that you can't be a startup or a well-established business.
And I think to answer the next question, how are applicants vetted, it would be under that same rubric of, fulfilling all the requirements that are in the RFP and, being successful. And then, what does it mean that the Ombudsman Program must have a standalone space? Can the Ombudsman have their own spaces within the agency office? Yes, they may have their own space, but there have to be those firewalls, and there has to be the ability to have the security, the locked cabinets, their own system, whereby there's no chance that some of the information will be bled through to other people within that organization. Is there a base salary that we're required to have for the Ombudsman, similar to the prevailing wage? Yes, I believe that under the city's policies, there is a minimum wage requirement, but as to the agency's prevailing wage within their own organization, as long as it meets the city's requirements, that would be probably what you would go with as an agency, as long as you fulfill that city requirement. There is a minimum wage ordinance. The question is, when you say there is a city requirement regarding minimum wage, is that the minimum wage ordinance or something else? That is the minimum wage ordinance that will go to $15 per hour in July. So that is a base minimum that is a requirement by the city. Of course, anything over that and accepted by your employees, we would have nothing to reply to.
Okay, so we're here at the point where we're going to wrap up. If we have other questions that you'd like to have answered, this is kind of the last call on those. I will be preparing the amendment on that reflects the correct date change, and that should be out by the end of the week. In terms of how to find this application or this webinar, we'll be posting a link to the YouTube video or the DFSS's YouTube site on the DFSS website. Also, we'll be sending a link to all the people who registered and attended this webinar. We thank you very much for your participation and your interest in the program.